What are the restrictions after surgery for activities? There's not many. Many people have the false perception that some other surgery, you can't lift weights, you're bedridden, or you should just not do anything you normally do. The complete opposite, really, for eye surgeries, RLE, cataract, LASIK, ICL. If you're dilated, you're probably not seeing well until you're not dilated anymore, and that's usually the day after surgery. But you can do whatever you can get away with doing the night after surgery or right after surgery. You can watch TV, if you can read your cell phone, you can see your computer screen, you can go online, do what you normally do. You can lift weights. I would say just take it easy. You're probably, got some sedation that you're not going to be working out or feel motivated to work out right after surgery. But certainly by the next day, you can jump on your bike, row, ride a horse, whatever you normally do. You can fly in a plane afterwards. That's no problem. There are eye surgeries where you wouldn't want to fly in a plane, and that typically involves a gas bubble inside the eye, and that's typically for cornea transplant or retina surgery or something like that. Your cornea or retina specialist will give you very specific instructions. But RLE surgery, cataract surgery, ICL, LASIK, none of that applies. You feel free to go fly in a plane. Don't go swimming. That's no swimming, no hot tubs, no makeup for 7 days. That's it. Just those things. And don't rub your eyes, obviously, for 7 days or so. Try not to touch the eye. And that those are all geared towards preventing an infection. And if you inadvertently maybe rub your eyes and you weren't sure if your hands were clean, just go ahead and put in a drop of your post-operative eye drops that contain antibiotics. That'll be it. And you're not going to get an infection. The chances of getting an infection, you'd have to really try to get an infection after cataract surgery. But the above, the swimming, the makeup, and rubbing the eyes vigorously, I consider that trying to get an infection. Don't do that for the first 7 days. Anyways, enjoy after surgery. Go back to doing everything you normally do. Expect that it may take a little while for you to get acclimated to the new way of vision, particularly for RLE surgery, and that the expectation is you're going to be functional the day after surgery. For most patients, like 98% of patients. If you're off target, well, we can give you some temporary glasses or contacts to get you through the first until things kind of settle out and you're back on target, or you're consistently off target, and we decide that we're going to do follow-up surgery to switch out the lens and address those issues. But anyways, hope that video helps. It is not as involved as it used to be. Now, older surgeons in their 50s, 60s, 70s will tell you otherwise, but that harkens back to their training and from 30, 40 years ago, where the incisions were like, half the eye was cut open to implant a lens or something. And yes, you're going to be bedridden if that were the case. You're not lifting any weights. But these days, with our minimally invasive surgeries that heal overnight, there are very, very little restrictions to your activities. Thank you.